Welcome to the Approach to ABG's Part 2. My name is Jason Wechter. In this presentation, we're going to cover compensation and mixed disorders. Remember that the body tries to keep the pH at 7.40. If a metabolic acid-base problem exists, the compensation will be a respiratory process. And if a respiratory acid-base problem exists, the compensation will be a metabolic process. The compensation process is always the opposite process of the primary problem. If the primary problem is acidosis, the compensation will be an alkalosis process. And if the primary problem is alkalosis, the compensation will be an acidosis process. We are now going to go through the 4 examples of compensation using this equation and arrows. If the primary disturbance is a metabolic acidosis, then the compensation will be a respiratory process and is also going to be an alkalosis process. So let's remind ourselves, a metabolic acidosis starts when the bicarb goes down. This will shift the equation to the left and increase the hydrogen ion concentration. We are indicating the primary process with black arrows. If we want to compensate for this process, we need to reduce the carbon dioxide. This will attempt to shift the equation back to the right, and this will attempt to reduce the hydrogen ion concentration. This is what happens in compensation. In this example, we show a primary metabolic alkalosis, and the compensation will be a respiratory acidosis process. So the first event is that the bicarb goes up. This will shift the equation to the right. This will drop the hydrogen ion concentration. To compensate for this, the carbon dioxide levels go up. This will try to shift the equation back to the left and increase hydrogen ion concentrations. The third example shows a primary disturbance of respiratory acidosis, and the compensation is a metabolic process and also an alkalosis process. Step 1, the carbon dioxide levels go up. This will shift the equation to the left and increase the hydrogen ion concentration. To compensate, the body will increase bicarb levels. This will attempt to shift the equation back to the right and will reduce hydrogen ion concentrations. Our final example is a primary disturbance of respiratory alkalosis, and the compensation is metabolic and an acidosis process. Step 1, carbon dioxide levels are reduced. This will shift the equation to the right and reduce hydrogen ion concentrations. To compensate, the kidneys will reduce the bicarb. This will shift the equation back to the left and attempt to increase the hydrogen ion concentration. It is very important that you understand and memorize these rules for compensation. The primary acid-base disturbance always happens first, and the compensation always happens second. Compensation is always in the opposite direction of the primary event when you look at the equation. Compensation is always the other process. So if the primary event is respiratory, the compensation will be metabolic and vice versa. Finally, compensation never overcorrects. It will never push the pH way back in the opposite direction. It always undercorrects. Let's use this pH diagram to explain compensation a little bit more clearly. A normal pH is 7.40. When an acidosis process occurs, the person will have a pH less than 7.35. When a small amount of compensation occurs, the pH will increase but the patient will still be in the acidosis range. When full compensation occurs, the pH will still be less than 7.35, but only by a little bit. We're going to draw this dotted red line to show that compensation never overcompensates. The person will never compensate past 7.40. The same concepts of compensation occur when the primary acid-base disturbance is alkalosis. A small amount of compensation will reduce the pH, but the person will still have a pH greater than 7.45, and a complete amount of compensation will result in a pH that's just a little bit higher than 7.45, but still in the alkalosis range. In order to interpret an arterial blood gas, you need to know what a normal bicarb and a normal carbon dioxide level is. The normal bicarb level is 24, and the normal carbon dioxide level is 40. There are normal ranges for these, but when you do calculations, you have to choose a single number, and these are the numbers you need to pick for calculations. When an arterial blood gas is written out, it's written out in the order of pH, PCO2, PO2, which is the oxygen level, and the bicarb. We're going to put the PO2 in gray because the PO2 is not used for acid-base disturbances. A normal arterial blood gas will have a pH of 7.40, a PCO2 of 40, some value of PO2, and a bicarb of 24. These are the normal values that you must memorize. We are now going to go through 4 examples of acid-base disturbances. The first example shows a pH of 7.21, a PCO2 of 60, and a bicarb of 24. Let's see if we can understand what's going on here. We know that the pH is low. Therefore, we know that the hydrogen ion concentration is elevated. In order for this to have happened, the equation must have shifted left. There are 2 ways for the equation to shift left. Either the bicarb level goes down, or the carbon dioxide level goes up. In this example, the bicarb level is normal, so it did not cause the shift. The carbon dioxide level is high. The normal is 40, and the carbon dioxide level here is 60. So we know that the carbon dioxide levels are high, and this is what caused the shift to the left. Therefore, this is an example of respiratory acidosis. In our second example, the pH is 7.54, which is high. The PCO2 is 40, which is normal. And the bicarb is 34, which is high. A 7.54 pH indicates that the hydrogen ion concentration is low. Therefore, we know that the equation shifted to the right. A high bicarb or a low CO2 would cause this. In this example, the bicarb is in fact high, and the CO2 is normal. Therefore, this is a metabolic alkalosis. Our third example shows a pH of 6.97, a PCO2 of 40, and a bicarb of 9. This is a very acidotic patient. The pH is very low, which means the hydrogen ion concentration is elevated. In order to accomplish this, the equation shifted to the left. The 2 things that will cause the equation to shift left would be a low bicarb or a high CO2. And in this case, the bicarb is low. Therefore, This is a metabolic acidosis. Our fourth and final example shows a pH of 7.60, a PCO2 of 25, and a bicarb of 24. The pH is high, therefore this is alkalosis, and the hydrogen ion concentration is low. In order to get a low hydrogen ion concentration, we shifted the equation to the right, and the two things that could do this would be a high bicarb or a low CO2. And in this case, we have a low CO2, and therefore this is respiratory alkalosis. The previous four examples were reasonably simple. They had no compensation. Only one process was occurring, and this makes interpretation easier. The next few examples will have compensation and might be more challenging to interpret. In this case, the pH is 7.31, the CO2 is 60, and the bicarb is 30. A low pH means acidosis. Therefore, the hydrogen ion concentration is increased. This means the primary process shifted the equation to the left. In order to do that, we would have needed a low bicarb or a high CO2. And in this case, we have a high CO2. We also have a high bicarb. This will shift the equation back to the right, which will reduce the hydrogen ion concentration. So this is an example of respiratory acidosis with compensation. This example again shows a pH of 7.31, a carbon dioxide level of 18, and a bicarb of 9. The low pH indicates acidosis, so the hydrogen ion concentration is increased, which means that the primary event shifted the equation to the left. This can occur with a low bicarb or a high CO2, and in this example, the bicarb is low. Therefore, this will be a metabolic acidosis. You can also see that the carbon dioxide is low. This will shift the equation back to the right, which will reduce the hydrogen ion concentration. Therefore, this is metabolic acidosis with compensation. This example shows a pH of 7.49, a CO2 of 49, and a bicarb of 39. The high pH indicates alkalosis, which means the hydrogen ion concentration is low. Therefore, the primary disturbance shifted the equation to the right. This could be caused by a high bicarb or a low CO2. In this example, the bicarb is high, so we know that the primary event is a metabolic alkalosis. We can also see that the carbon dioxide level is high. This will attempt to shift the equation back to the left and increase the hydrogen ion concentration. In summary, this is metabolic alkalosis with compensation. The previous examples demonstrated compensation. The following examples will demonstrate two primary problems that do not compensate each other. In this example, the pH is 7.18, CO2 is 49, and the bicarb is 18. This is acidosis, therefore the hydrogen ion concentration is increased. Therefore the equation shifted to the left. This can occur with a low bicarb or a high CO2. And in this example, we have both of those things, low bicarb and a high CO2. Therefore, this is a mixed acid-base disturbance. This is a primary metabolic acidosis and a primary respiratory acidosis. In this example, the pH is 7.61 with a carbon dioxide of 30 and a bicarb also 30. The pH of 7.61 is alkalosis, therefore the hydrogen ion concentration is low. Therefore, the equation was shifted to the right. A high bicarb or a low CO2 will cause this shift. In this example, both of those processes are present. Therefore, this is a mixed acid-base disturbance with a primary metabolic alkalosis and a primary respiratory alkalosis, and there is no compensation in this blood gas. The two previous examples had two primary problems that were either both acidosis or both alkalosis. What happens if the two primary problems are different? One of the primary processes is alkalosis and the other one is acidosis. Let's see what happens. Here is another example with a pH of 7.41, a PCO2 of 56, and a bicarb of 34. Again, the pH is in the normal range. The bicarb is elevated, which will shift the equation to the right, and the carbon dioxide is also elevated, which will shift the equation to the left. And on the surface, it might look like these two processes are compensating for each other. But the reason they are not is because the pH is in the normal range. Remember that compensation always undercompensates. Therefore, a normal pH with a abnormal CO2 and abnormal bicarb indicates two primary processes. This is an example of a primary metabolic alkalosis and a primary respiratory acidosis, and no compensation. In this example, we have a pH of 7.40, a CO2 of 31, and a bicarb of 19. The pH is perfectly normal, and therefore the hydrogen ion concentration is also normal. The bicarb is low, and this is going to shift the equation to the left. The CO2 is also low, and this is going to shift the equation to the right. These two actions are balancing each other out, and therefore we have a primary metabolic acidosis and a primary respiratory alkalosis. This is also called a mixed disorder. So we've shown you a number of examples, and it might start to get confusing for you. Just to summarize the last two cases that we looked at, it's important to look at all three pieces of data. And if you have a normal pH, but the CO2 and the bicarb are not normal, then you have two primary and opposing disorders. There is no compensation because compensation is a secondary event and will not give you a normal pH. We're going to pause here and just do a little summary of the 5 different combinations that we have discussed so far. First, if the pH, PCO2, and bicarb are all normal, then there is no primary disturbance and therefore no compensation. We've looked at examples where there is a primary disturbance and no compensation. We've looked at a primary disturbance with compensation. We've looked at two primary disturbances that are both in the same direction. And we've looked at two primary disturbances that are in the opposite direction, giving us a normal pH. We have discussed whether compensation is present or absent. We also need to consider whether the compensation is partial versus full. When partial compensation occurs, the primary disturbance will become less severe, and when the compensation is full, the primary disturbance will almost be returned to the normal range. So for example, with acidosis, the pH when the compensation is full will still be less than 7.35, but it'll be fairly close to 7.35 most of the time. This is an example where there is no compensation. You already saw this blood gas where the pH is very, very low and the bicarb is very low. So this is a metabolic acidosis, but the PCO2 is normal. It hasn't changed at all. It's like there has been no attempt to compensate for this primary metabolic acidosis. So we can summarize that absent compensation exists when the pH is abnormal and either the carbon dioxide level is abnormal with a normal bicarb, or the reverse of that, an abnormal bicarb with a normal carbon dioxide. To reiterate, when compensation is full, the pH will be close to but not equal to the normal value range. So in the example of acidosis, the compensation will result in a pH that is slightly less than 7.35. When the primary acidosis is severe, the full compensation will be even lower than this. So a fully compensated severe acidosis could in fact have a pH of only 7.25. Remember that a full compensation will never bring the pH into the normal range and never will cross 7.40. The easiest way to define partial compensation is to figure out how much full compensation would be, and if the patient did not compensate that much, they therefore have partial compensation. There are a set of calculations that are used for determining partial versus full compensation, but they're actually a little bit hard to remember. So to start you off, let's focus on some easy rules. Rule number one normal value means no compensation. So if you have a normal carbon dioxide or you have a normal bicarb and the pH is abnormal, then there is no compensation. Rule number two, if the pH is just outside of the normal range, so just below 7.35 or just above 7.45, it is probably full compensation. If the pH is far away from the normal range, so significantly less than 7.35 or significantly greater than 7.45, it's either partial compensation or it could be full compensation if the primary event was really severe. Rule number four, if the pH is near 7.40 and the PCO2 and the bicarb are both abnormal, it is probably a mixed disorder. So we just summarized some simple, easy to remember rules, but there's a harder to remember rule, which is a set of ratios. And we use these ratios to determine whether the compensation is partial or full. For example, if the carbon dioxide goes up by X, then the bicarb will go up by Y to compensate. Different sources, textbooks or websites, give slightly different numbers and ratios. So there is probably no one exact true value, and depending on where you look, you're going to see a slightly different set of rules, which might be different than the numbers or the ratios that are presented in this presentation. Okay, so here are the ratios, and this is a little bit mind-numbing, but this is just the way it is. When the primary disturbance is a metabolic acidosis, for every 10 points that the bicarb drops, a fully compensated patient would have a carbon dioxide level reduce by 10. So a 10 to 10 ratio. With a metabolic alkalosis, if the bicarb rises by 10, the CO2 will only rise by 7 when it compensates. For respiratory alkalosis, if the carbon dioxide drops by 10, the bicarb will compensate by dropping only 5. And for a respiratory acidosis, if the carbon dioxide rises by 10, the bicarb will compensate only by rising 3 points. So there's 4 different numbers to remember based on the 4 different primary disturbances, and there's 2 patterns that maybe will help you remember these a little bit more. Pattern number 1, you can see that the carbon dioxide levels move more than the bicarb levels. The carbon dioxide adjusts by 10 or 7, whereas the bicarb only adjusts by 5 or 3. The second memory tip is that things drop more than they rise. You can see that the carbon dioxide drops by 10, but only rises by 7. The bicarb drops by 5, but only rises by 3. So these 2 different patterns might help you remember a little bit what the ratio values are for the 4 different primary disturbances. Let's look at an example. The pH is 7.25, CO2 is 28, and the bicarb is 12. The metabolic acidosis is the primary event. The bicarb is down from 24 to 12, which is a drop of 12. The carbon dioxide is also down from 40 to 28, which is also a drop of 12. The ratio is 12 to 12, which is the same as 10 to 10. Therefore, this is a fully compensated metabolic acidosis. In this example, we have a pH of 7.48, a CO2 of 25, and a bicarb of 18. Respiratory alkalosis is the primary disturbance. The carbon dioxide is down from 40 to 25 for a drop of 15, and the bicarb is down from 24 to 17, a drop of 7. A ratio of 15 to 7 is about the same as a ratio of 10 to 5, and therefore this is full compensation. What about this example? 7.48, CO2 of 44 and a bicarb of 30. Metabolic alkalosis is the primary event. The bicarb is up by 6. The CO2 is up by 4. This is a ratio of 6 to 4, which is pretty close to 10 to 7. So this is also full compensation. And you can see that the pH is slightly outside the normal range. Our last example, pH 7.32, CO2 of 60, bicarb of 30. Respiratory acidosis is the primary event. The CO2 is up by 20, the bicarb is up by 6. This gives us a 20 to 6 or a 10 to 3 ratio. This is full compensation. And pay attention, the pH is slightly outside the 7.35 range. So we just showed 4 examples of fully compensated primary disturbances, and in all 4 examples, the pH was not in the normal range. What if you had a patient who was overcompensated? Well, overcompensation is never overcompensation. It would always be a second primary event. And this is also called a mixed disorder because there is more than one primary event. So we can kind of look at a quick summary of compensation. If you have a normal ABG, you will have no compensation because everything is normal. You could have an abnormal pH, but either the CO2 or the bicarb is normal, and that would indicate no compensation with an abnormal blood gas. Compensation can be partial. It can also be full. But if you think you have overcompensation, you will have a second primary disorder. This is the end of compensation and mixed disorders. This is the hardest part of blood gas interpretation, and if you're feeling a little bit overwhelmed or confused, you're not alone. You will probably not feel comfortable with this topic until you have practiced a fairly large number of cases and really establish this concept into your skill set.